Alright, the figure 8 exercise can be used as an assessment tool and as a therapeutic tool. In the first video, it's going to be used as an assessment tool. I'm going to ask the client to start the figure 8 in the center of the page. Figure 8 should be big. And then we're going to ask the client to move slowly to the right. And ask them if they feel any discomfort in their head when they're doing this. I'll ask them to come back to the center and then continue to the left. Oftentimes you might get people who cannot do this because they don't know there's a left side of the page or a right side of the page. At that point you would ask them to open their eyes. Because usually if they don't know there's a right or a left side, they'll just stay here and think that they're moving to the right or left. They're actually not moving to the right or left. And that's with the right hand, and then you want them to repeat it with the left hand the same way. I'm not going to do that. For the sake of the internet, I need to keep this short. However, what we're going to do now is we're going to start it and we're going to ask them to repeat the exercise, but this time with their eyes closed, and to pay attention to what it feels like inside their head. Is there any disorientation? Is there any kind of discomfort, pins and needles, anything? So again, the directive is to stand if they can. If they're in a wheelchair, then you just ask them to do the best they can. So standing allows them to get a better swing, and we want the motor functions to move as much as they can. Okay, that's a good quick one, and then you would ask them to come back. At this point, I'm going to demonstrate, you want to go left hand, and their eyes should be closed in the second part of this. Alright, the eyes should be closed. And then you're going to ask them to come back, which is not really great, but obviously I have some trouble on that side. But at least I know the page is there. Okay, so that's for assessment purposes. And when you want to have this for homework, that's a different story. Because by that time you've identified what they can and cannot do. And if there's neglect on either the right or left side, then you want them to take this whole tablet of 18 by 24 newsprint home, and you want them to do this exercise with their eyes open and their eyes closed until they feel comfortable and they know there's a right and a left side and there is no problem. Okay? So that's the end of this exercise.